So Tammy's a mental health charity that works with sport clubs, youth groups and schools, and we use sport and play as a tool to raise awareness of mental health and emotional wellbeing. So we actually turned 10 in November 2021, we started in 2011, and the charity's named after Tommy Tucker McLachlan, who died by suicide in 2009. We started a project working with 2 sport teams. We now work with 129 on a regular basis, 10 schools approximately in North Belfast and 4 youth groups. So we're well established, we're doing a lot of group work, and we've got a lot of continuity about our approach, which is mental wealth games, sport and wellbeing through play. It is something that has hit home really hard when you see the devastation in the families, you see the devastation firsthand as being affected directly by it. And you can come at it, this is we were very much at the start about suicide awareness. But when you're coming at it from that angle, it's quite dark and quite off-putting. You do make people feel a bit uncomfortable when you talk about the topic. And we thought, look, let's stick to coming at it from a positive mental health and emotional wellbeing angle. We've got the amazing organisations that are out there support people. And the fact of the matter is, support is always available. There's the 24-hour helplines, the Samaritans and Lifeline. We're in North Belfast, there's Aware, the Mental Health Mail I call it. You've got Aware, you've got Lighthouse, and you've got PIPS, Bridge of Hope. There's so much services there for people. It's just inspiring the confidence to encourage help-seeking behaviour, to get people to reach out. And we feel our approach of young people is doing just that.
As I say, it's devastating for the local community when they hear if someone's died, and the knock-on effect that has on the community. And I think ultimately it's about that localised plan, because while the Department for Health has strategies, and we know that there's now a mental health champion been in place, I think more localised approaches to identify the need at a local level is really, really important, and to pull all the different resources together. Because if we're going to deal with this, I know we have a mental health pandemic and it's been in crisis now for many years. We need everybody working together. We need the local community, sitting together around a table with the Trust and with all the different charities that do provide that really important support. North Belfast also has the highest rates of drug-related deaths, which is also very sad too. There's many reasons why people will experience distress. Poverty is a big problem in North Belfast, deprivation, housing. I mean, every single day I get phone calls from people who are on a waiting list who are living in housing stress, and how that impacts on the family unit. It can be tough, very tough for people living in North Belfast because of all the different social problems that we experience. There's also a lack of dual diagnosis support, so people who would be maybe, have an addiction, but also experiencing, mental health problems as well. There's a lack of that support. So basically, what happens is a person might refer to addiction service, but also refer to mental health service. But really, what should be happening is they should be dealt with together. So one of the big things we've been asking for is a lot more support around dual diagnosis, which is really important in North Belfast, given there is an increase in people dying through drug misuse, but also through suicide as well.